Good evening. We present the news summary. Elvis Julie has been appointed as a new member of the Electoral Commission. During a swearing-in ceremony at State House this afternoon, Mr. Julie took on his new role in the presence of President Wavel Ramkalawan and other high government officials. Mr. Julie is replacing Veronique Bonlam Alcedo.
Over the years, I have participated at various levels in electoral voting, and I haven't yet been in the commission as I am today as a commissioner, but I play different roles. I'm quite conversant with the electoral law and the act of the election, if I want to put it properly, and also with the changes that is happening right now in terms of the amendments that are being brought forward. So I think my role will be one which will be more strategic at this point of time. I think my experience in management, in leadership position, so I think it will come handy in helping me to discharge my role and responsibility as a Commissioner of Election.
Also, during the ceremony, Justice Bernardin Renault was reappointed as the chairperson of the Human Rights Commission after completing a 5-year term. Justice Renault said that during his new mandate, he will be concentrating on educating the society on the role of the Commission.
Our strategy now is to move from, we have strengthened or developed our structure. Now we're strengthening our structure and focusing on media, on education. Because we believe that once people understands, not only the people on the street, but the institution of government, ministries, departments and agencies, we want to focus on educating, informing, so that people will understand the aspect of human rights as set out in the Chapter 3 of the Constitution, where we have to give life to what is written in Chapter 3 of the Constitution.
More than 1,000 people have been able to consult for free doctors and specialists on board the Chinese hospital ship Ark Peace since the vessel arrived in Seychelles last Friday. No prior appointment is needed to seek treatment on board the vessel, which came to Seychelles for the first time in 2010. The head nurse of Ark Peace, who spoke to the press via an interpreter, said that people can also get medication for free following a doctor's consultation.
中医科、口腔科、眼科、骨科都很受欢迎。
People coming here for doctors of traditional Chinese medicine, orthopedics, ophthalmology, and stomatology. They are all welcomed by locals.
眼科手术、口腔科的一些治疗都是开展的很多的。
Some treatments in the dental clinics and the cataract extraction surgery by our ophthalmologists. That's the most common surgeries we have done on our ship.
他们感受都很好，我们很热情，病人也对我们很好。
After consultation, our patients will take medication, and their experience after Medicare is satisfied. They are satisfied after consultation because they can receive treatment by our doctors and take medication for free, and go back home just satisfied.
Some medical professionals and specialists from Ark Peace visited Victoria and the Answayal hospitals this morning. The activity is part of an exchange between Seychelles and China on medical procedures. At the Seychelles hospital, the medical professionals got the opportunity to visit different facilities, see how the staff work, and interacted with some patients. As for Answayal Hospital, patients were who had booked appointments were able to be examined for different cases. The Seychelles New Hospital Fundraising Committee has been assured of the support of businesses and individuals to raise as much money as possible for the construction of the new health facility. This was during a gala dinner hosted by the committee this weekend on Pralin. It was held at the Raffles Hotel and attended by some 100 Pralinois and Digwa The event did not raise as much money as it did on Mai, but the organizers appreciated the contribution they received. President Ramkalawan gave details on where the new hospital will be located.
It will be where the old casualty was before. Most of us who are now over 50 remember when the casualty was, where the casualty was. It will take the blue roof, it will take the green roof, it will take the medical stores. And so as you go up Victoria Hospital, as we stand, you've got the yellow roof on the right, and on the left will be where the new hospital will be. There's so much work to be done. Whatever method of payment, of construction we adopt, still Seychelles will have to pay at the end of the day. So whatever amount we raise, every little cent will go towards giving Seychelles a modern hospital.
A group of health professionals is being trained in palliative care. The training, organized by Hope Foundation in collaboration with the Ministry of Health, saw the participation of health officers, including nurses, doctors, social workers, and physiotherapists.
Palliative care is a specialized medical care for people living with a serious illness. It is focused on providing relief from the symptoms and stress of the illness. The goal of palliative care is to improve the quality of life for both the patient and the family. It was the patron for the Hope Foundation, First Lady Linda Ramkalawan, who officially opened the workshop today.
And very often, the doctor, when there's nothing that can be done medically for the patient, they often ask the family to take the patient home and make them comfortable. For most of us in this situation, we find it a very daunting task and a very fearful one. And we have to admit that apart from feeling incapable of caring for that person, we also have this fear of death.
The aim of this workshop is to further develop the skills of the health officers to better care for the patients who need palliative care. The 9-day training is being facilitated by 2 health officers from the Association of Palliative Care Centre based in South Africa.
It's that introduction to palliative care and what it is and what it how to integrate that for the patient, how to control pain, or getting the relevant role players involved. It might be for a specific patient, it could be they might be needing a little bit more spiritual care, or they might have some financial issues. So it's about bringing the relevant team members in at the right time to relieve suffering, which could be worries about financial issues. It could be about pain. It could be about many different things. But it needs to be relevant at each stage of that patient's journey, where they're at today. If we can resolve what they need today, it just helps that patient and that family significantly.
Palliative care is appropriate at any age and at any stage in a serious illness, and it can be provided along with curative treatment. The Principal Secretary in the Ministry of Health, Dr. Bernard Valentin, says that they want to sensitize the public on palliative care as well as provide the necessary resources. Dr. Valentin says that more health professionals will be trained in palliative care.
And this was the news summary. More details at 8 p.m. during the News Creole Bulletin. Thank you for your attention.